Hello and Minglaba. Welcome to MI Radio's Myanmar Today. I'm Henry Zin. State Counsellor urges people to endure for a few more months and stay alert. Ministry of Health and Sports lifts stay-home restrictions in Insein Township. A report on the current situation of Beijing nucleic acid test. And a story coverage on inland water transport emphasizing passengers' safety as a priority in the rainy season. All these reports coming up later on Myanmar Today, but for now, let's take a look at what's happening in local news. State Counsellor Aung San Suu Kyi held a video conference on Tuesday with senior health officials, stressing the need for continued vigilance among the public regarding COVID-19. The State Counsellor said it's been found that the public has become stressed out and careless. As a result, she has become a bit worried. She said people should not be careless. Therefore, from the viewpoint of prevention as well as treatment, the public should be informed about the things that need to be heeded and why. That was why she wanted health professionals to make people understand these things clearly. Now is not the time to become careless and carefree. If the public could follow the rules and maintain discipline for another 2 to 3 months, it would be possible to arrive at a situation where people could say they have overcome the danger. This is not to say definitely that such a situation could be reached. She said as the Department of Health has a responsibility for the whole country, she wanted the discussions to cover from the viewpoint of the Ministry of Health why the people should not let their guard down and the kind of things the people should be especially careful of. The Central Committee for Organizing Union Peace Conference 21st Century Panglong held a meeting Tuesday. Union Minister Din explained plans for holding of the upcoming peace conference in new normal and discussions with EAOs and their agreements on the reduction of overall participants to 1/3. Director General also presented preparatory plans for the peace conference. The union ministers of respective committees discussed invitations, accommodation, transportation, security, press and information, healthcare, banking, and coordination works for the peace conference. Union Minister for International Cooperation Din participated in the video conference of the special ASEAN-Australia Foreign Ministers meeting on COVID-19 on Tuesday from the Ministry of Foreign Affairs in Naypyidaw. The ministers underscored the importance of enhancing ASEAN-Australia cooperation in 3 areas of mutual interests, namely health security, stability, and economic recovery. The ministers appreciated the substantial ASEAN-Australia cooperation and welcomed a package of initiatives to strengthen ASEAN-Australia partnership on COVID-19 response and recovery, and they also discussed to continue cooperation through ASEAN-led regional mechanisms to mitigate the health, economic, and social impacts of COVID-19. Union Minister Din updated the meeting on the measures taken by the government to control the pandemic and mitigate its economic impacts and to ensure early recovery. Union Minister for Commerce Dr. Tham Mien held a Zoom meeting with Myanmar commercial attaché from foreign countries on Tuesday, discussing 3-year trade promotion plans between Myanmar and the respective countries. Myanmar commercial attaché in China's Beijing, Nanning, and Hong Kong, Japan, South Korea, Thailand, Singapore, India, the United States, and Belgium participated in the video meeting. Speaking at the meeting, Union Minister Dr. Tham Mien said COVID-19 has affected all sectors of countries around the world, including Myanmar, especially job opportunity. He said based on agriculture, the government, in cooperation with the public, is making efforts to increase local purchase demand and get production sufficient. He also urged the commercial attachés to try the best to analyze the country's capability for trading and investing, and make strenuous efforts to assist the nation's economic development. The Ministry of Commerce made decisions to relax restrictions on rice export during the meeting with the Myanmar Rice Federation on 26th of June. Aiming to promote the country's rice export and change reserved rice scheme, the ministry has given green light to export 150,000 tons of rice each in July and August starting the 1st of July, and 100,000 tons of rice in September, totaling 400,000 tons in 3 months. The ministry also urged the MRF to work for exporting 2.4 million tons of rice targeted in the 2019 to 2020 financial year. The meeting also agreed to lift restrictions on the volume of rice export of companies commencing next month and to issue license licenses under the contracts. From the 1st of July, rice traders were required to sell only 5% of export volume for state-reserved rice scheme, reducing from the existing 10% with 2.5% before applying for an export license and the remaining 2.5% within 15 days after securing the license. The MOC has also allowed extending the term of rice export license from 45 days to 60 days. 5 Ayeyarwady dolphins, including a 1-month-old baby dolphin, were found dead within 6 months in the Ayeyarwady River, along with Mandalay to Bamor, according to the Endangered Species Conservation Division under the Fisheries Department. Another 1-year-old female baby dolphin was reportedly found dead early morning on 27th of June at St. Bangong village in Myanmar Township, Mandalay region, according to the Fisheries Department. The department seized 10 illegal electrofishing boats in 2017, 20 in 2018, 31 in 2019, and 19 in 2020 with 3 illegal fishermen. The illegal fishing boats were handed over to the Fisheries Department. In the Ayeyarwady Conservative Area, the related Fisheries Department is conducting awareness activities of the illegal electrofishing in cooperation with Wildlife Conservation Society. That's all with the local news. Let's take a look at the first report now. Witnessing the carelessness of people because of COVID-19 cases being slowed down, State Counsellor hosted the regular video conference and talked about the public awareness for protection against COVID-19. She encouraged the people to keep following the health guidelines for 2 or 3 months to keep the good condition and to prevent a possible second wave of the virus. Dora Swayson will tell us more.
It has been 3 months since the first confirmed cases of COVID-19 were found in Myanmar by the late March. With the realization of restrictions and because of the calm situation of local transmission, people tend to get bored with staying in restricted lifestyle and they became more careless. Therefore, State Counsellor Aung San Suu Kyi, who is serving as the chairperson of the National Central Committee on Prevention, Control and Treatment of COVID-19, repeatedly reminds the public to be aware of the possible second wave of the virus spread. The State Counsellor hosted the video conferencing to raise public awareness during current situation of people being incautious. With the participants, Dr. Danalwin, Deputy Director General Disease Control of Department of Public Health of the Ministry of Health and Sports, Dr. Myin A, Medical Superintendent of Yangon General Hospital, and Dr. Chuchu Santu, Specialist from Pan General Hospital.
Our success in control activity is because of the early actions taken. Myanmar is one of the countries which released early guidelines. Since 4th of January, we did carry the necessary preparedness for the COVID-19, while other countries did not take much serious. At present, for weeks, there have been no transmissions among local residents. While receiving overseas returnees, the fact we have to notice is that COVID-19 has different mutations in different regions. Most of the patients in our country are asymptomatic, so self-awareness is critical.
As an effort to control and prevent the spread of the virus, the ban on local and foreign travel, control on overseas returnees, contact tracing, and giving treatment to suspected cases, laboratory upgrade, establishment of quarantine centers, stay-at-home plans, closures of factories, restaurants, schools, ban on festivities and mass gatherings, and finally distribution of protected items were implemented. After 3 months of outbreak in Myanmar, there are 299 patients with 221 recoveries and 6 deaths until the end of June. This is quite lower than the expected cases by the medical professionals.
When the first confirmed cases were found locally, the citizens were frightened and followed the health guideline by the ministry. But now the local transmission is down, even the increasing number is not that high, and the death rate is only 2%. So along with the easing of the restriction, some are careless. Because of the closure for months, the business are running again for the recoveries. This is not the time to relax and be careless. If we look at the other country, the new outbreak can happen at any time. So I want to suggest the public not to be reckless.
In border areas, the designated hospitals are upgraded and volunteers are helping out in quarantine centers where receiving returnees. Out of total overseas returnees who have already tested for COVID-19, only 0.2% showed positive. With the slow increase of the positive cases, the number of patients under investigation PUI also becomes lesser in number. In Yangon General Hospital in April and May, there were about 100 PUIs every day getting treatment, with the rate of 25 to 30 new PUIs coming in every day. Out of 1,147 PUIs from Yangon General Hospital, 11 cases showed positive.
Because of the quarantine system as well as the stay-at-home plans in respective townships imposed in April and May, there are only 2 or 3 new PUI patients coming every day at present. More patients suffering from other diseases or accidents are coming back to hospitalization. There will be much more patients of vehicle accidents because many people and vehicles are going outside as normal. If the COVID-19 cases are rising again because of the weakness in following health guidelines, we will have difficulties to give proper and specific treatment.
We have taken early steps in prevention and are in good condition now. But if we stay careless right now, all the efforts we have taken in the past will be a waste. It is such pity to let all human resources and physical resources we have used to be in vain. I also do not want my citizens to feel over-frightened. They need to have cautiousness in daily life, which is not much burden.
The state councillor mentioned that to have more positive patients is the struggle for the country, for the patients as well as for the surrounding. She told the public to endure 2 or 3 more months for the emergence of a situation better than the present by following the basic health guidelines. She also acknowledged the voluntary spirit of the youths as well as the union spirit of the people in the country. Dora Susan, news reporting from Myanmar International Radio.
That's a report on the State Councillor urging people to endure for a few more months and stay alert. We'll move on to the next report. The Ministry of Health and Sports lifted the stay-home restriction in Insein Township. Since the infection cases were on the rise at the end of March, the government imposed stay-at-home orders in 10 townships in Yangon, including Insein Township, which has 44 infected cases. The total number of the coronavirus cases is at 299 with 6 deaths and 222 recovered patients in the country, according to the Ministry of Health and Sports. Pomo has more.
The total number of the coronavirus cases is up to 299 with 6 deaths and 222 recovered people in the country, according to the Ministry of Health and Sports. The Ministry of Health and Sports lifted a restriction on stay home in Insein Township. As the infection cases were on the increase at the end of the March, the government imposed stay-at-home order in 10 townships in Yangon, including Insein Township, which has 44 infected cases. Uwe Pyohan, Region Lhotto representative from Insein Township Constituency 2, spoke to MI Radio through phone interview about the relaxation of stay-at-home restriction in Insein Township, and he said,
Semi-lockdown restrictions in some townships were relaxed in the previous months. Insein is the last one. Some were impatient at the restrictions as we had to ask for recommendation letters if they went to another region or state for some emergency cases. But what we need to know is that this is only the relaxation of stay-at-home order, and we didn't allow them to do events and gatherings of more than 5 people. 36 out of the 44 infected cases had recovered and were in a good health. 3 patients at Paungji Medical Center tested negative twice, and 5 people in Saru Klapa Women and Children Hospital tested negative once. Everything seems going to be in a good situation, but we have to protect and prevent ourselves from the second wave by following the rules and regulations from the Ministry of Health and Sports.
State Counsellor Aung San Suu Kyi also said on her Facebook page that she hoped Myanmar would be able to push back the second wave of COVID-19 if effective measures could be taken to prevent the spread of the disease during the next 1 or 2 months. She also said that during this month, they have planned to be able to relax the stay-at-home arrangements in all the townships. Though the government urged the people to stay alert about the infections, some people seem careless about the infection cases. It has been 6 times restrictions extended, although some have been gradually removed. Professor Dr. Mamaji, the senior consultant physician from Insein General Hospital, spoke about the current situation of the virus infection in the country through the phone interview. She said,
There are about 8 to 35 people came to the fever clinic regularly. In the hospital, we tested 8 to 10 suspected patients. We told everyone who came to the hospital must wear the mask and wash their hands. We have enough protective measures against the infection. With the approval from the Ministry of Health and Sport, we are going to plan to test some suspected patients through the mobile fever clinic. Most of the people don't wear the mask, and some put the mask on the chin. When we look at the cases, children are the least in the infection. Most of the cases are from the middle age and older people. In our country, there were 6 deaths and 5 were the older people. That's why they need to be more careful about it. They became careless about the observance of the social distancing. Announcement from the Ministry of Health and Sport, the government will relax some restrictions, but they need to follow the guidelines.
U Wen Luen-u, a taxi driver from Dakomyote South Township, spoke to my radio about his opinion on COVID-19. He said,
As a taxi driver, I have to deal with a lot of people. At first, I have a lot of difficulties because the government told the people to stay at home. During this day, people started to come out to the road, and I can say that the taxi business is in a good situation. I always wear a mask. I urge my customers to wear the mask as I drive the taxi near the hospitals. Wearing masks are the good protection for us because we can't see the virus with our eyes, and now some cases have been found out without showing the symptoms. We have to protect ourselves as much as we can.
While Myanmar has effectively mitigated the spread of the disease through quarantines, contact tracing and testing remains one of the most effective ways of quickly identifying cases. Myanmar has 5 testing centers, 1 in Mandalay, 1 in Molomyai in Mon State, and 3 in Yangon. As of the 29th June, the laboratories have tested over 74,900 people, according to the Ministry of Health and Sports. The COVID-19 has started the second wave infection in the worldwide. The global pandemic has spread to 188 countries, killing over 508,000 people, afflicting over 10,412,000 people, according to the Worldometer Coronavirus Resource Center.
That's a report on the Ministry of Health and Sports lifting stay-home restrictions in Insein Township. More reports coming up later. Stay with us. According to the report by Beijing Health Commission, more than 300 people have been infected by COVID-19 in the capital of China, and the responsible authority is doing everything from running a nucleic acid test to contain the virus. As of 28th of June, more than 8 million people have taken the test so far. The authority says although the situation is quite complicated, it is going well to bring the positive results in containing the virus. For more on the story, we turn to our reporter, Willinson.
The Beijing Health Commission said on Tuesday that 7 new locally transmitted COVID-19 cases were recorded on Monday, raising a total infection to 324 since 11th of June, when the first case from Beijing's Xinfadi market cluster was detected. As of Sunday last week, 8.29 million samples were taken for nucleic acid tests, meaning that nearly 40% of capital's total population has been tested for COVID-19. The reports say that Beijing is facing the new wave of the outbreak from the last few weeks. Mazda Chinewun from China Media Group CRI Myanmar Department talked more about the condition now in Beijing and said,
Beijing မြို့ရဲ့အခုလက်ရှိအခြေအနေနဲ့ပတ်သက်ပြီးပြောရရင်တော့Beijing မြို့အစိုးရကဒီ22ရက်နေ့ရပေါ့နော်ယောဂထိန်းချုပ်ရေးဆိုင်ရာသတင်းစာရှင်းလင်းပွဲအရယောဂထိန်းချုပ်ရေးအခြေအနေကအခုခက်ခဲရှုပ်ထွေးနေသေးတယ်ဒါပေမဲ့အခြေအနေကတော့အကောင်းဘက်ကိုတိုးတက်ပြောင်းလဲနေတယ်လို့ထုတ်ပြန်ခဲ့တယ်ဒါကြောင့်မို့လို့သက်ဆိုင်ရာအနေနဲ့လည်းပေါ့နော်ယောဂထိန်းချုပ်ရေးကိုတင်းတင်းကြပ်ကြပ်လုပ်ရမယ်လို့ပြောကြတာတွေ့ရတယ်လက်ရှိမှာတော့ Beijing မြို့မှာတစ်မြို့လုံးပိတ်ပြီးတော့စီမံတာမျိုးတော့မတွေ့ရပါဘူးယောဂထိန်းချုပ်ရေးကိုပဲအလေးပေးပြီးတော့ဆောင်ရွက်နေတာကိုတွေ့ရတယ်Beijing မြို့သူမျိုးသားတွေကလည်းကြောက်ရွံ့နေတာမျိုးတော့မရှိပါဘူးပုံမှန်သွားလာနေကြတာပါပဲ COVID-19 ဖြစ်ပွားမှုမရှိတဲ့နောက်လူနေရက်ကွက်တွေကုန်စုံဆိုင်တွေစူပါမားကတ်တွေစားသောက်ဆိုင်တွေနဲ့ဒီစံသားဆိုင်တွေပေါ့နော်ပုံမှန်လည်းပတ်နေတယ်မော်တော်ကားသွားလာမှုကလည်းစီစီကားကားရှိစေပါပဲ
Among the confirmed cases, the authority also reported the asymptomatic case, and the authority emphasized importance to testing the people who might have more social contacts with the people. The report stated that the authority, as of Saturday last week, more than 100,000 delivery men in Beijing have received nucleic acid tests, and all of them tested negative for COVID-19. The State Post Bureau also said it would strengthen disinfection at the workplace and enhance health management of delivery men. Maza Chinewin also spoke further on the differences of case from that of Wuhan, and she said,
Beijing ကကြတော့ဒီတကြောပြန်ကူးစက်မှုကတော့ဒီရှင်းဖာတီပေါ့နော်ကုံစိမ်းလက်ကားစီကိုတွားရနေပြီးတော့ကူးစက်မှုဖြစ်တယ်လို့သိရတယ်။ယောဂဖြစ်ပွားနိုင်တဲ့အကြောင်းရင်းကနှစ်ခုကတော့ဒီအေးစိမ်ထားတဲ့ပင်လယ်စာအသားငါးတွေကနေဖြစ်နိုင်တယ်လို့ဒီလူသွားလာဝင်ထွက်မှုတွေကနေကူးစက်မှုဖြစ်နိုင်တယ်လို့ယူဆကြတယ်။ဝူဟန်နဲ့ပတ်သက်လို့ကတော့ဒီကောလာဟာလာတွေမျိုးမျိုးတွေရှိကြတယ်။ကမ္ဘာ့ကျန်းမာရေးအဖွဲ့ကတော့ဒီကိုရိုနာဗိုင်းရပ်စ်ကလင်းနို့တွေကနေပြီးတော့ပြန့်နှံ့လာခြင်းဖြစ်နိုင်တယ်ပေါ့နော်။နောက်ပြီး COVID-19 virus ကလူလောက်တာမဟုတ်ဘူးတဘာဝအရာဖြစ်တယ်လို့ပြောကြတယ်ဒီလ26ရက်နေ့ကဒီ Spain virus ပညာရှင်တွေပြောတာတော့တဲ့လွန်ခဲ့တဲ့နှစ်မတ်လကပေါ့နော်ရေစိုးရေညစ်နမူနာတွေမှာ COVID-19 virus ကိုတွေ့ရှိခဲ့တယ်ဒါဟာတရုတ်ပြည်မှာပထမဆုံးပေါ့နော် COVID-19 ကူးစက်ခံရသူတွေ့ရှိခဲ့တဲ့အချိန်ကထက်6လပိုစောတယ်ဆိုပြီးဆိုကြတယ်လက်ရှိအချိန်ဒီကတော့ဒီယောဂဘာကြောင့်စဖြစ်တယ်ဆိုတာနဲ့ပတ်သက်ပြီးတော့စုံစမ်းနေကြဆဲမိခွန်းထုတ်လို့ကောင်းနေကြဆဲပါပဲရှင်
Speaking on the condition of nucleic acid tests, Maza Chinewin also said,
Beijing မြို့မှာလူပေါင်း8တန်း2,9,900ရဲ့ဒီ nucleic acid ပေါ့နော် sample တွေရရှိခဲ့ပြီလို့သိရတယ်။လူ9တန်း6,8,900ကိုဒီ nucleic acid တိုင်းတာစစ်ဆေးမှုတွေပြုလုပ်ပြီးပြီ။ nucleic acid တိုင်းတာစစ်ဆေးလိုတဲ့လူအားလုံးကိုလည်းတိုင်းတာစစ်ဆေးပြီးပြီလို့သိရပါတယ်။ Beijing မြို့မှာ nucleic acid စစ်ဆေးနိုင်စွမ်းရှိတဲ့ဆေးဝါးကုသရေးဌာန128ခုရှိပါတယ်။ Alpha nucleic acid တိုင်းတာစစ်ဆေးဓာတ်ခွဲခန်း16ခုအထိကိုတိုးချဲ့တိစောက်နေတယ်။တိစောက်ပြီးလို့ရှိရင်တစ်နေ့ကိုလူ3သိန်းတိုင်းတာစစ်ဆေးနိုင်မယ်လို့လည်းသိရပါတယ်။
We have one last report on inland water transport coming up on Myanmar Today. Stay tuned, we'll be right back. Inland water transport is placing emphasis on safety of passengers as a priority during the rainy season since water transport is one of the important sectors. In the water transport sector, river crossing ships known as ferries are providing water transport services while sampans are transporting passengers crossing the river to and from the banks of the river. During the rainy season, there will be frequent occurrences of strong winds and torrential rains in Yangon River, so the IWT is laying emphasis on the safety of passengers as a priority after setting up the plan. Zueman reports.
The inland water transport is placing emphasis on the safety of the passengers as a priority during the rainy season, as the water transport is one of the important sectors. In the water transport sector, river crossing ships known as ferries are providing water transport services, while sampans are transporting the passengers crossing the river to and from the banks of the river. During the rainy season, there may be frequent occurrences of strong winds and torrential rains in Yangon River, and so the IWT is laying emphasis on the safety of the passengers as a priority after setting up the plan. Dr. Kenu, manager of Pensodan Jetty of the IWT, said,
We are now emphasizing increase in camp and the safety of the passenger. When there is a heavy rain and strong wind, we have to reduce the run of the ferries. If there is a poor visibility, the ferries are not allowed leaving the jetty. The reduction in the in-camp and the ferry run doesn't matter, but the safety of the passenger is our first priority. When the heavy rain and strong wind occur, the passenger can scramble aboard the ferry. When the passenger gather at one side of the ferry, it can lean to the other side. For this, we are educating the passenger how to take the ferry. Life jackets are placed in the easy reach of the passenger. There are about 20,000 passengers a day. This number is still less compared with the figure before the COVID-19.
The passengers to Bensudandala ferry are on the increase now. Before the COVID-19, there were about 30,000 passengers a day. In a little while, the number of passengers will be back to normal figure. Umye A, captain of Cherry Ferry 1 of the IWT, said.
For ensuring the safety of passengers during the rainy season, we have arranged for 56 life rafts placed on the roof of the ferry and 1,200 life jackets. These materials come from Japan. We are telling the passengers with the use of loudspeakers not to get off the ferry before it stops and to get on the ferry only after wearing the masks. We have to pay attention to the weather condition and maintain the ferry as well. One ferry run has to carry 450 to 500 passengers. The safety of the passenger is of great importance. The life jackets are the double number of the passengers. Life-saving materials are also placed aboard the ferry. The crews of the ferry must be always active and they mustn't be sleepy. Social distancing guidance is also well prepared.
One ferry has to provide 46 runs a day and 2 ferries run a day. During the Insein period, there were 300 to 500 passengers. After Insein, the number of passengers rose to more than 5,000. In May, there were about 8,000 and early June, there were between 12,000 and 15,000. At the end of June, the number has gone up nearly 20,000. Komyotan, in charge of Sampan Gate Supervisory Committee for Tanliat Sampan Gate, said.
We don't allow the sampans to run when the heavy rain and strong wind take place. We allow the sampans to run only when the weather is fine. The fitness of the sampan is always checked and the sampan walkers are also supervised. In the past, a sampan carried 10 passengers, but now it transports only 7. The sampan ticket price is not increased and the passenger costs 200 jets. The chartered price for a sampan is 1,500 jets. There are a total of 46 sampans in this gate. The number of passengers currently becomes more.
Kopiezong, a passenger from Insein Township, said.
We are taking the ferry with my friends to go to Tundi. In the bus, we were afraid of the water transport, but now we don't need to be frightened because the ferry prepared for life-saving materials, including life jackets. We really feel secure when we take the ferry. The crew of the ferry warn the passengers with the use of loudspeaker to be careful about the get on and get off the ferry while rain is showering. We thank the responsible person of the ferry for providing proper management for the passengers.
Now is the time that can limit the spread of the COVID-19 infection, but it can be totally kept controlled. The respective government departments are carrying out anti-COVID-19 measures. The responsible persons are warning the people to follow health guidelines issued by the ministry concerned. The IWT is providing water transport service for ensuring that the passengers reach the downtown Yangon in a short time, upholding the preventive measures against the COVID-19.
That's all we have for today's reports. And here are the international news on Myanmar Today. Spain on Tuesday shut down 8 of its 15 coal-fired power stations on grounds that they were unprofitable and also to comply with European regulations on industrial emissions. The move comes 18 months after Spain closed down its last coal mines, although the country remains behind on its drive to embrace renewable energies. It also came as experts said that coal had reached its economic tipping point, meaning it was cheaper to use renewable energy sources than to continue operating coal-fired power stations. A flag-raising ceremony was held at Golden Bauhinia Square in Wan Chai, Hong Kong's special administrative region on Wednesday to celebrate the 23rd anniversary of Hong Kong's return to China. Meanwhile, the national security law has been issued to ensure social stability and future development under the principle of one country, two systems.
The flag-raising ceremony to celebrate the 23rd anniversary of the establishment of the Hong Kong Special Administrative Region of the People's Republic of China now begins. Please stand solemnly and face the national flag and the regional flag. Pray! Present! Out!
起来，不愿做奴隶的人们，把我们的血肉铸成我们心的长城。中国民族到了最危险的时候，每个人被迫着发出最后的吼声。起来，起来，起来！我们团众一心，冒着敌人的炮火前进，冒着敌人的炮火前进，前进，前进。
The top U.S. envoy for the Democratic People's Republic of Korea said Monday that another summit between President Donald Trump and the DPRK's leader Kim Jong-un is unlikely before the November presidential election in the United States. Stephen Biegun, Deputy Secretary of State and lead negotiator on DPRK's nuclear weapons program, made the comment during a virtual forum hosted by the German Marshall Fund of the United States, a think tank headquartered in Washington. Last week, Trump's former national security advisor John Bolton wrote damning accounts of the U.S. president's engagements with Kim in his newly published memoir, The Room Where It Happened. According to the book, Trump told South Korean President Moon Jae-in ahead of his third meeting with Kim at the demilitarized zone in June 2019 that he might ask for the next U.S. DPRK summit to be after the U.S. elections. Meanwhile, sources said Tuesday that Biegun is planning to visit South Korea as early as next month. Brazil has become the world's number 2 hotspot for COVID-19 cases, reaching 1,368,195 cases with a total of 58,314 deaths. In early June, the government stopped updating the total number of coronavirus fatalities and infections, a move critics call an attempt to hide the full toll of the disease. James Allen has worked as a grave digger at the biggest cemetery for 7 years. They used to bury around 30 to 40 bodies on a busy day. Nowadays, they are doing more than 50 burials every day. Let's watch this video.
É triste, só que é para a segurança dos demais, né? Para que as pessoas não se contaminem. Então tem que reduzir mesmo para que as pessoas venham estar protegidas. Vocês, assim, cemitério, casa. Tá de todo mundo assim. A gente já dorme pensando no dia seguinte. Como vai ser amanhã? Quantos sepultamentos nos espera? Quantas pessoas mais vão falecer? A gente tá assim, nessa rotina.
This is a second try for the Singapore government's Trace Together token, a wearable device that can detect if you've had close contact with someone infected with the coronavirus. On June 28th, the first batch of Trace Together tokens was handed out to vulnerable seniors. The new generation of Trace Together tokens is a wearable that can be helpful for groups who do not have access to mobile devices. Each token has a unique QR code and a battery life of 6 to 9 months with no charging needed. The token works by exchanging Bluetooth signals with other nearby Trace Together tokens or phones with the Trace Together app. If the user is detected to be close to someone infected with the coronavirus, he or she will get warnings from an officer from the Ministry of Health contact tracing team. The government will only collect data from users who are confirmed to be infected with the coronavirus. The data will only be kept for up to 25 days. Well, that's all we have for now. Thanks for joining me on Myanmar Today. I'm Insein. Stay safe and stay protected, everyone. I'll see you again. Goodbye.